Well, it's the disease that's affected at least one person we know and love. Dementia is the second leading cause of all deaths in our country and the number one leading cause for women, with that number projected to double over the next 30 years.
Australians are banding together this week for Dementia Action Week, building awareness, taking action, also spreading the word on exactly how to support and prevent. So Dr. Helena is an expert in this field and joins us now from Melbourne. Morning to you, Doctor. I wonder if I could start off, please, by trying to define or explain the difference between dementia and also Alzheimer's.
Yes, good morning. Well, dementia is an umbrella term that describes over 100 different diseases of the brain that affect memory, personality, mood, ability to communicate and thinking skills to a greater or lesser degree depending on which part of the brain is affected. And Alzheimer's disease is the most common form of dementia. It accounts for 60 to 70% of cases. That's why we hear the most about it.
Can I just ask, we just talked about this in the intro, why is dementia twice as common in women than it is in men?
Well, we used to think it was because women live longer, but we now know it's much more complicated than that. A likely contributing factor is the massive decline in estrogen, specifically the hormone estradiol during menopause, which can lead to reduced brain cell energy, lower levels of antioxidants and fewer brain growth factors, and all of these things can compromise brain function. And women who have their uterus or ovaries removed prior to menopause also increase their risk of Alzheimer's unless they take menopausal hormone therapy, MHT, immediately after their operation and at least until the age of 50.
Gosh, I feel like that's something that a lot of people would not realise. I mean, as a female myself, just that piece around the hormones even, I feel like that actually is quite surprising to hear.
Yes, it's really important. And also other things probably, the fact that depression is also more common in women than in men, and untreated depression is a major risk factor for dementia. Women have a lower tolerance for the harmful effects of alcohol on their brain. They don't tend to recover as well as men from head injury. And the other thing people don't realise is we know that women have less muscle mass, and the stronger your muscles, the stronger your mind, because just like there is communication between the gut and the brain, there is a lot of communication between our muscles and our brain. So we have to exercise our muscles, and particularly strength training from our mid-30s onwards so we don't lose muscle, because strong muscles equate to a strong mind.
Doctor, just quickly, what can we do to reduce the risk?
I think a dance a day keeps dementia away, because 30 minutes of moderate to vigorous daily exercise halves the lifetime risk of dementia, and that includes brisk walking, jogging, cycling, swimming, kayaking, referring to your earlier story. Dancing is also mentally challenging, and lifelong learning protects the brain from decline. Give your brain a reason to stay sharp, and it more likely will. And you don't have to be good at something. It's just the effort of learning that protects your brain. Dancing is very social, and having good relationships is critical for good brain health, because having a confidant, feeling part of a community, strengthens our immune system, lowers levels of the stress hormone cortisol, reduces inflammation. All of these things reduce dementia risk. In contrast, loneliness is as damaging as smoking 15 cigarettes a day, and smoking increases the risk of dementia by 70%, and dancing is fun. Positive emotions, experiencing joy and gratitude also reduce dementia. And you can read about all the other ways to boost your brain in my latest book, Can Adventure Prevent Dementia? There are dozens of other ways, simple things like flossing your teeth, getting 7 to 9 hours of good quality sleep, and every soft drink is a bullet to our brain with the soft drinks.
Wow.
Because
Tell you what, I'm experiencing joy and gratitude just from chatting to you today. Doctor, thank you very much for all the information. That's great.
Yeah, that's fantastic.
My pleasure. Thank you.